Hi guys, this is Dr. David Warwick, Warwick Chiropractic in Lacey, Olympia, Washington, your Seattle, Tacoma, and Lacey chiropractor. Today, actually, this type of video was actually inspired by a patient who had a question of how long certain tissues take to heal. So I thought I'd bring that to light a little bit and giving you an idea, whether it's a muscle or a ligament or a tendon or both, causing the type of pain and what we're looking at. So I'll keep this rather short. A lot of times when you're in a collision accident or injury, you'll experience types of symptoms such as neck pain associated with a whiplash type injury, even from slips and falls. Many of these individual pain relief type conditions can result in muscle tightness and the pain associated with this type of event that goes on in us. Sometimes you don't even know what caused it and it can happen in like seconds, that much damage to the tissue. So giving you some perspective on what it takes and why we end up making the recommendations that we do. And some of these are standard, some are less, some are more, in type of duration of the healing process that occurs. So just to put this in perspective, when a bone is fractured, actually that type of tissue heals fairly quickly. That's 8 weeks. When a muscle is injured or torn, and depending on how much that muscle was torn, can take 3 to 4 months. If a tendon has been irritated, torn, now these are ranges of time. If a tendon has been torn or stretched beyond its normal elasticity in there or give to it, takes anywhere from 8 to 10 months. Ligaments, 18 months, even 24 months. Nerves can take even up to 2 years to 3 years for regeneration of that type of tissue. Because one, there's such a vascular network that can go on and healing time in the body. Now, some of this is a little less, some of it's a little bit more, and I can relate to that in personal experience, like when I was playing some rugby at one of the games in chiropractic school, at one of the practices. I ended up blowing what is called the ACL, so I have a full ACL replacement in there. And I remember even after the surgery, how long it took before feeling started to regenerate. For example, obviously they took a graft of the patella and they implanted it with titanium type screws to anchor it in and act as that barrier as the knee moves back and forth in there. Well, here's what I can relate to, especially, the range. I did all the physical therapy, of course, got adjusted, all that benefited me. But the one thing, even after I improved the range of motion and was getting adjusted and in better alignment, the one thing that I noticed that seemed to be taking my left knee was constantly numb all the time. Numb, especially around the surgery site, but mainly around that knee area. And well, what happened? They had to create an incision onto the knee and do the replacement and get that grafted in and getting that area to heal. Well, when you start to do surgical, even small cuts, even little ones, it affects the nerve patterns that are in there. It affects the tissue. It affects the nerve that's communicating to the skin level. Well, I had this constant numbness to the knee that took years. I'm going to say well over 5 years before it even started feeling somewhat normal. I think less than 10 years that I just noticed it, like it feels fully, that area of the skin feels fully intact again, that I can actually feel that. So, when we look back at the individuals who have pain relief and we look at what's causing the pain and look at how various tissues can affect that, we look at through a thorough examination, questions, asking about symptoms, finding where the pain is, asking you certain questions of what it feels like to you, all these types of things. If there's been past history of dislocation or fractures that created different types of injuries or impacts in there. When it comes to the muscles moving, moving. So essentially the muscles move the bones, right? And the muscles are attached to the bones with what we call tendons, and that creates the motion or movement in there. Ligaments are what actually hold the bones together. And every one of these can be rated in a mild, moderate, or a severe type pain, and the healing depends on that level of tearing or damage to that tissue. Some of it lasts a little bit longer, some of it a little bit less, especially with sprain strain type injuries. And we have to give certain respect to that healing time. And also understand, just like the neck and the back, there's over 8 layers of muscle that are in the back, and so this can stretch, and it's very unique in how each of these muscles perform a certain action or movement. And some of that area needs a support, some of it's shorter term, long term, as well as, once we get the help we need, it allows for a deeper healing to occur. So when you're a patient at Warwick Chiropractic here in Lacey, Seattle, Washington, we look at various ways that we can do to, one, first and primarily get you out of pain as quickly as possible, but get as quick as we can the amount of correction that you need to either the spine or to the area of the extremities, such as the shoulder, elbow, wrist, hip, knee, or even foot, low back. We look at all those aspects of that to help and shorten the duration of time. Some of that includes referring to other healthcare providers, such as a massage therapist. We work with physical therapists. I work with the local orthopedist, radiologist in the area, and you create a whole team approach to helping you heal. So I hope this information helped you a little bit and shed some light on some of the things that may be going on, and a little bit of understanding of how when various tissues get injured, hurt, or have been chronic, things go on. And I sometimes jokingly say, listen, I'm not Harry Potter. I can't make 20 years of an injury disappear and go away quickly. Although that's sometimes what you guys want and the market wants, but realistically, that's not always going to happen. So I'm Dr. David Warwick of Warwick Chiropractic. If you're looking for relief care for your back or neck pain, or maybe pain in the shoulders, knees, or in the hips or feet, ankles, elbow, or your wrist, I may be your guy. So thank you for watching. I'll see you soon. Bye.